Hello everyone, my name is Adenike Eketunde. I'm a doctor and I'm very passionate about health and creating awareness. Thank you for coming to my YouTube channel. Thank you so much. Today I'll be talking about sexual transmitted disease, STD, vaginal discharge and UTI. Don't go anywhere, stay tuned, we'll be right back. Welcome back. Like I said earlier, I'm going to be talking about sexual transmitted disease, urinary tract infection, and vaginal discharge. Sexual transmitted diseases are diseases that are transmitted during sexual intercourse or oral sex. It is very common. It occurs in 1 out of 2 sexually active individuals before the age of 25, and it's common among young adults because that's when they are most sexually active. Today I'm going to be talking about the causes, I'm going to be talking about the signs and symptoms, and I'm going to be talking about the complications, then myths about sexual transmitted disease. When I'm talking about the complication, I want people to realize that sexual transmitted disease is not something to be ashamed of. If you feel you have any reason to go to the doctor, go and see the doctor, because it is better to treat it now than to suffer from the complications of sexual transmitted disease. If you think you have it, go and see your doctor, let them check you out. And if you have to bring your partner to get treated, do that. Prevention is always better than cure. And there are complications to this. I'm going to be talking about it later, so stay tuned. What are the common causes of sexual transmitted disease? I'm going to be just mentioning like lists now. So we have chlamydia, gonorrhea, syphilis, herpes, hepatitis, HIV, amongst many, but that's the one I'm going to be talking about because that's the most common cause of STD in our society. So chlamydia, gonorrhea, they give almost the same symptoms, and when you go to the hospital and you get tested, they're going to treat you for most likely the two. Then syphilis and herpes, these are diseases that causes lesion on the genitalia, that's on the private part. Herpes and syphilis, they causes lesion on the genital area, and this lesion can be painful or non-painful. Herpes causes painful lesion, while syphilis causes painless lesion. So whether it is painful or non-painful, once you notice any new lesion on your genital, you need to go and see your doctor. And herpes is highly transmittable, it's very infectious, so it is very important to be aware of your body. And you can get herpes even when the partner uses condom, because it is highly infectious. So you need to practice safe sex, and you need to be aware of your partner sexual status. Is the person someone that practices polygamy or monogamy? So you won't want to be with someone that has multiple sexual partners, because you are at risk of having STD because your partner has multiple sexual partners, even if you don't have multiple sexual partners. And syphilis can cause painless lesion. Like I said earlier, it can cause fever, enlarged lymph nodes, fatigue, you start feeling soreness, aching, fever. So these are things you need to be aware of. That maybe you notice a new lesion on your genital tract and on your genital area, and you realize that you're having fever recently. These are signs, these are red flags. Go and see your doctor, get treated. And the thing about syphilis is that when I'm going to talk about this in the complications, is that when you don't treat it, it can lead to more serious disease and illnesses. It can lead to lack of coordination, it can lead to numbness, paralysis, blindness, dementia. That means you forget things. So these are things you have to consider when you notice anything. So you won't say that because you don't want anybody to know that you have syphilis and you just hide it and it develops to tertiary syphilis. You end up dying because of something that you can have prevented. So it is very important to go and see. It's also a sexual transmitted disease that is known to cause cervical cancer. So this is why you should practice safe sex. Also use vaccine. There's vaccine for HPV virus to help prevent cervical cancer. There's also vaccine for hepatitis B. just take your vaccine. It will prevent these things because some of these things, some of this diseases, you can't see. You don't even know if this partner have it or not. And sometimes the guys are carriers. They don't show sign or symptoms that they have it, and they might not even develop this disease, and you'll be the one that they transmit the disease to, that you have the disease. So it is very important for HPV to take your vaccine, and most of the time it takes a while to develop into cancer, cervical cancer, and you can always do your pap smear. From the age of 21, it is advisable to start doing your pap smear. If it's negative 2 times, then you can do it in the next 5 years, because it takes a while to develop into cancer. I'm talking about complications of sexual transmitted disease. One of the major complications of sexual transmitted disease is infertility, and the reason why you can easily get infertility is because sexual transmitted disease causes pelvic inflammatory disease, PID, and this PID causes adhesion and scarring in the uterus, because it moves from the vagina up to the uterus, and it gives symptoms like lower abdominal pain, discomfort, adhesion, and it can even cause ectopic pregnancy because of PID, which is as a result of recurrent sexual transmitted. Complications of syphilis, tertiary syphilis too. We have dementia, you start forgetting things, loss of coordination. It can also lead to death. Complications of HPV, when you don't treat it, when you don't go for your pap smear, when you don't take your vaccine, includes cervical cancer. Untreated cervical cancer can lead to death if it enters stage 4. Complications of hepatitis, when you don't take your hepatitis vaccine, when you don't prevent yourself, include liver cirrhosis and liver cancer. So it is very important to take care of yourself before it leads to these complications. Check yourself. If you have vaginal discharge, pain on urination, lesion that looks like wound on your private part, go and see your doctor. Let them test you so that they can know the appropriate drugs to give you. It's important to know that sexual transmitted disease is curable, is treatable, and it can lead to complications that can lead to infertility and lifelong disability and death. So it is important to treat it while you can. UTI is an infection of the urinary tract. It affects the part of the body where you urinate, while STD affects the part of the body, the genitals that you use in having sex. That's just infection of the vagina and cervix up to the uterus. And UTI affects the urinary tract, which can lead to kidney disease, because that's the part it follows, part of the complication of UTI. UTI is very common in females because of the way the urinary tract is positioned. It is very short in females, and females have 4 times the risk of having UTI than males. Males' UTI is usually complicated. It's usually due to sexually transmitted disease because of the way their genitals is. It is well protected, unlike females. Females' urinary tract is very short. That's why it is advisable for females to wipe from front to back, because when you wipe from back to front, you have increased risk of transmitting organism from the back to the front up to the urinary tract. So it is very important to be also aware that the symptoms include pain, because pain on urination, which is a sign of infection, fever. So once you have pain on urination, fever, you can check your doctor. It might be most commonly due to UTI or gonorrhea. Just test yourself to be aware. Like I said, in sexual transmitted disease, it also have complications. It can move up to from the bladder to the ureters to the kidney, and it can cause signs of kidney disease or infection, and it can lead to kidney failure, which include flank pain, decreased urination. So it is very important to be aware of those things. So I'll be talking about myths Myths and misconception about STD. The first one I have here is I'd know if my partner had an STD. How? Most STD are asymptomatic. There's no way you can know except the person has symptoms, and most of them, they don't have symptoms. Yes, and one of the symptoms is foul smelling vaginal discharge during sexual intercourse. What if the person doesn't have foul smelling discharge? Does that mean that the person does not have STD? No, the person might have STD, can infect someone else and still not have symptoms. So that's a myth. The second one here is, if I trust the person I'm dating, we don't need to do STD test. Hey, well, if you are sure you're in a monogamous relationship, or you are married and you know your partner, there's trust, and you've done it before, I don't know if you should still do STD testing. But if you have the symptoms, yes, you should. That means one partner is infected, so you should do your test once you have symptoms. But if you're in a monogamous relationship and you trust your partner, I don't think you should just randomly say you want to do an STD test. That's disrespectful, and you've been dating for a while or you've been married for a while. I don't think. But yeah, just be sure that you're in a monogamous relationship, just you and your partner. It's safer like that. I go to the doctor regularly. If I had STD or if I have STD, I would know. No, if you don't go and check yourself and do specific tests for sexual transmitted disease, there's no way your doctor can know. If you don't complain to her that you have vaginal discharge, you have pain on urination, you have fever, she won't, because she won't just randomly ask you that you should do STD test. So because you go to the doctor regularly does not mean that you don't have STD. It is very common, and if you have the signs and symptoms, or you are practicing unprotected sexual intercourse, you need to change. Still use your protection. Oral sex isn't risky, so I don't have to worry about it. Well, like I said, if you are talking about HIV and all, oral sex has reduced risk of transmitting sexually transmitted disease, and except if you have like a wound or like a break in the skin and you can easily transfer body fluid, the risk is not that much. But it is also good to be aware that disease like herpes is easily transmitted through oral sex. Like I said earlier, herpes is highly infectious. So herpes, syphilis, gonorrhea, you can still catch it through oral sex because it's contact. Yeah, and HPV too. Another one, women don't need to carry condoms. That's the man's job. Just be safe. If you know you have it, use it. If you know you cannot use condom, abstain. Abstinence. If you don't have sex, there's no way you can get a sexual transmitted infection. But women do have condom, and to be safe, just in case your partner don't have a condom, you should always carry your condom too. I'm over 50. STDs aren't an issue for me. Yes, we know STD is common among young adults, but it's about your partner. Because you're over 50 doesn't mean you can't have STD. You can still have STD. So that is a myth. I can't get herpes from someone with no symptoms. Hey, that's also a myth. You can get herpes from someone even without symptoms. There are therapies people use to suppress the symptoms, and you might not even know. It might not be visible, but the person is highly infectious. So you don't have to see the symptoms to be infected. If I'm honest about my herpes, I will never date again. I'm honest about it. I don't know. It's your choice. You can still date. But people will still be scared. Like, they will still want to use protection and all. It depends on your partner. They don't mind. I know people that have come out as HIV victims and they still have sex with people. They use protection. So it depends on your partner and if you have a mutual agreement and understanding. Consistent condom use is unrealistic. I think it depends on the partner. It is realistic. And if you're married and you trust your partner, you are in a monogamous relationship, you shouldn't really worry about STD except you have symptoms like I said, and you don't have to worry about condoms and all. That's if you trust your partner and you're married or you're in a monogamous relationship. You might not want to use condom every day for you if you think it's unrealistic, but to protect yourself, always use condom. But for married couples, I don't think it's realistic though. They are married, that's why I said monogamous relationship. And married doesn't really mean that the person is not cheating or something. That's why I said if you still have symptoms like vaginal discharge and all, go and see your doctor. They can treat the both of you. Another myth is that lesbians don't need to have safe sex. Go to the gynecologist. No, they do, because it's about your partner. What if the partner involves in activities like drug use and all? You don't EPIs. You need to be careful, and some of those people might have other partners, guys, girls, yeah. So irrespective of your sexual status or preference, if you notice anything, you should see your doctor. Another one here is that oral contraceptives can protect against STI. No, oral contraceptives protect against having a baby. It prevents pregnancy and not sexual transmitted disease. So if you're using oral contraceptive, your risk of getting an STI is the same with someone that is not taking oral contraceptive. So it is very important to know that oral contraceptives is for pregnancy and not for STI or sexual transmitted disease. STI will go away on their own. Well, some, but it's still in your body, like syphilis. After a while, when you have the lesion, the chancre, it might go on its own, but the symptoms is gone, but you still have the infection in your body, and it can cause tertiary syphilis, which I explained earlier, which can even lead to death. And diseases like HPV, even or herpes, the lesion might go away, but you're still infected, and you might get the complications later in future. So even if you feel like it will go away, once you have the symptoms, go and see your doctor. So it's a myth. It's not really gone. It's still in your body. Well, there are some that will go on its own, like some HPV virus that your body can deal with, but not every time. If you have an infection, go and see your doctor. The symptoms might subside, but the infection, you need to know what is actually going on. So I'll still advise you to go and see a doctor. And the fact that STD will go on its own, I don't know, it's a myth now. Okay, it depends on how you feel it. If you have any infections, still go and see your doctor. You don't have to wait till it goes on its own because of the complications which I mentioned earlier. Okay, that's all for today. I hope you enjoyed watching my channel, my show. I hope you learned a lot today too. Thank you for watching. God bless you. Subscribe, like, comment. Let me know how you feel about it. Stay tuned. Until next time, keep watching E Health Domain.